All right, good evening, everyone. We're going to go ahead and get started. Thank you for joining us tonight. Hopefully you are all here for the same thing, which is our first session of a 4-part series for Medicare 101, everything you need to know, or everything you didn't want to know, depending on how you look at it. Couple of housekeeping items. I will pause at the end of each section of this presentation to see if anybody has any questions. You are welcome to ask questions either by typing into the chat box, or at the end of each section when I pause, you're welcome to unmute yourself and ask your question live, and I'm happy to answer them. Hopefully everybody got the email that I sent earlier today that included a copy of the slides for today's presentation, as well as the handouts that I will be referencing during the presentation. Also, I want to mention that you will be sent a survey at the end of the presentation or sometime early tomorrow. The survey is a Medicare survey. It is specifically for this SHIP program, the State Health Insurance Assistance Program. And it is, the survey results do go directly to the Administration for Community Living and the Administration for Management and Budget at the federal level. So if you would take that survey when you receive it, we would greatly appreciate it. It does help us secure funding in the future for this program so that we can provide this information and education at no cost to the public. And I think that's all the housekeeping. So let's go ahead and get started. So again, welcome. Thank you for joining us. My name is Roma. I'm with the Area Agency on Aging and I'm the coordinator for the local SHIP program. And this is part 1 of a 4-part series for Medicare 101. Tonight, we're going to be talking about Medicare eligibility and coverage. We've got a lot of information to cover. So let's get started. So to start with, again, I'm with the Area Agency on Aging here in Colorado Springs. The mission of the Area Agency on Aging is to remove barriers to independent living so that people can stay in their homes in the community for as long as possible. Our Area Agency on Aging serves 3 counties of Colorado, El Paso, Park, and Teller. I'm also with the SHIP program, which is a federally funded program. There is a SHIP counselor or a SHIP program available for every county in every state of the country. And the SHIP program provides free, unbiased, in-depth one-on-one insurance counseling. We can counsel on all aspects of Medicare and all coverages or issues related to Medicare, including Medicare Advantage plans, drug coverage, Medigap plans, retiree coverage. We also can assist with applying for financial assistance programs for people who are on limited or low income. The SHIP program out of the Area Agency on Aging actually serves 9 counties in Colorado, and those counties are listed. You can reach us by either calling our local Colorado Springs number, or you can call the toll-free statewide number listed on the slide. Whenever you call the toll-free statewide number, it does route you to the SHIP office closest to where you're calling from. And again, every county in every state of this country has access to a SHIP counselor or a SHIP office. So again, tonight we're going to be talking about the basics of Medicare, including coverage and eligibility. Medicare obviously has 3 primary parts: Medicare Part A, Medicare Part B, and the new prescription drug benefit. And then we'll also talk about, not tonight, but we'll talk about next week, Advantage plans, also referred to as Medicare Part C. But first, we're going to talk about who runs Medicare. So Medicare is run by 2 federal entities. Social Security, or the Social Security Administration, is the entity that actually determines who is eligible for Medicare, who's eligible to receive Medicare. Social Security also enrolls people in Medicare. They provide you with the Medicare ID card. You can reach Social Security by their toll-free number, which is available 7 a.m. to 7 p.m. in all time zones. I've also provided our local office contact information for our regional Social Security office. However, they are currently still not doing in-person contacts with the public. So you can only reach them by phone, or you can visit the Social Security website, ssa.gov, 24 hours a day, 7 days a week. So again, Social Security determines who gets Medicare, determines the eligibility. They enroll you in Medicare. So to enroll in Medicare, you actually contact the Social Security Administration, and they provide the Medicare cards. Once you're enrolled in Medicare, then Social Security wants nothing to do with you. Once you're actually enrolled in Medicare, if you have any questions regarding your Medicare benefits, you would contact the Centers for Medicare and Medicaid Services, which I will otherwise refer to as Medicare. CMS, or the Centers for Medicare and Medicaid Services, actually administers the Medicare program. They process Medicare claims. They determine benefits that are going to be covered. They pay the providers directly. You can contact Medicare by their toll-free number, which I've listed on the slide, or you can go to their website, medicare.gov. There is no brick and mortar location for Medicare, so there is no option to actually go and talk to Medicare. You can only contact them by phone, or you can go online to their website. So you go to Social Security to enroll in Medicare. Once you're enrolled in Medicare, all Medicare questions or concerns would be addressed directly with Medicare. So who can have Medicare? Basically, anybody who is turning age 65 or older and has paid into the Social Security tax system through payroll taxes and is a US citizen will be eligible for Medicare. You can also be eligible for Medicare if you are determined to be disabled by Social Security and receive at least 24 disability payments, and that's at any age. You can also receive Medicare at any age if you are diagnosed with end-stage renal disease or kidney failure, or at any age if you are diagnosed with Lou Gehrig's disease or ALS. And then any lawfully admitted resident alien who has resided in this country for at least 5 consecutive years and is becoming age 65 is eligible to purchase Medicare. So when should you enroll in Medicare? Well, these days you don't necessarily have to be retired to enroll in Medicare, and more people are not retiring at age 65 when they become eligible for Medicare. But you do still have enrollment periods that you need to be aware of based on that turning 65 event. So when you are nearing age 65, you are going to be coming into what's called your initial enrollment period to enroll in Medicare. The initial enrollment period lasts for 7 months, and it includes the 3 months prior to the month of your 65th birthday, the month of your birthday, and up to 3 months after the month of your 65th birthday. That is your initial enrollment period. That's your time frame to enroll in Medicare without penalty or delay. There are other times you can enroll, such as special enrollment period, which typically only applies to people who continue to work past age 65 and delay enrollment into Medicare based on the fact that they are employed and covered by employer coverage. Or you can enroll during the general election period, which is an annual enrollment period for people who did not take advantage of their initial enrollment period or special enrollment period. That general election period runs January 1st to March 31st every year. If you're enrolling in the general election period, because that's the time frame that you have left to enroll in, your coverage would not start until July 1st of that year, and you could potentially be looking at penalties for late enrollment. And we will talk about that in more detail as we go along here. So this is what the Medicare card looks like these days. I tend to refer to it as the red, white, and blue card. It includes your name. It includes your Medicare number, which these days is a random series of letters and digits, or letters and numbers as an ID number. It's no longer a Social Security number. And it indicates your effective dates for Medicare Part A and Medicare Part B only. So a couple of things you need to take into consideration if you're approaching Medicare age or Medicare eligibility. And the most important one is to make sure that your contact information is up to date at Social Security, specifically your mailing address. If you need to update your address at Social Security, you can do that by calling them, or you can go online to the Social Security website and create a My Social Security account, which allows you to not only update your personal contact information, you can also use that account to apply for Medicare when the time comes. You can get estimates for retirement income. There's a lot of features that you can do through the My Medicare account on the socialsecurity.gov website. Social Security does strongly encourage people to create Social Security accounts for themselves, but it's not required to enroll in Medicare or otherwise. Also, just a quick note that if you get any phone calls, any emails, any messaging that suggests that that someone else needs your bank account information, your Social Security number, or any information of that kind in order for you to receive a Medicare card, please be wary. Social Security will not contact you unless you contact them first to gather any additional information about enrollment into Medicare or any Social Security matters. So any calls that you get that were not initiated by you are probably not going to be legitimate calls. So be very careful about what information you might give somebody. All right. In the email that I sent out earlier today, I did include some handouts for Social Security. One of them was what you can do online that gives examples of the different kinds of services that you can access by creating an online account or through their website. And the other one was specifically on how to create a Social Security account and enroll in Medicare through the Social Security website. I also sent you an email, or in that email, a handout that explains how to create a My Medicare account. So you've got two separate entities, two separate websites, Social Security or SSA.gov and then Medicare.gov. They are two separate accounts. They do not link to each other. It is, again, encouraged that you create accounts for both of these websites, but it is not required. But I did provide information on how to do that. Again, there are strong advantages to creating those accounts for yourself, but it, again, is not required that you do so. Any questions about any of that so far? Again, if you have a question, you can simply unmute or you can type it into the chat box. No questions? All right, then we will move on. So now we're going to talk about the different parts of Medicare. So once you're enrolled in Medicare Part A and Part B, we're going to talk about what that provides to you. And we're going to start with Medicare Part A, which is primarily your hospitalization benefit. Things to take into consideration again is whether or not you need to sign up for Medicare. So if you are already collecting an income of any kind for any reason from Social Security, when you become eligible for Medicare, whether it's due to turning 65 or because you have been determined and approved for disability through Social Security, if you are collecting an income of any kind from Social Security, when you become eligible for Medicare, Social Security will automatically try and enroll you in Medicare A and B. They should mail you a Medicare ID card up to 3 months prior to the month of your eligibility or 65th birthday. And they will automatically start deducting the cost of Medicare out of your Social Security income the month you become eligible. If you are not collecting an income from Social Security when you become eligible, it will become your responsibility to contact Social Security if you want to enroll in Medicare at that eligibility. If you are still actively employed, or you're the spouse of an active employee and are covered under employer health insurance, you may be able to delay enrollment into Medicare, into any part of Medicare, in favor of that employer coverage, health coverage. And that would allow you to delay enrollment, and it would waive any penalties if you enroll in Medicare once that employment ends. And we will talk about that in more detail. For most people, Medicare Part A is probably going to be at no cost. And that's because you have paid into the Social Security income tax system through payroll taxes. In order to be eligible for Part A at no cost, you would have to have paid into the Social Security income tax system for a minimum of 40 work quarters, which is the equivalent of 10 years of work history. That 10 years of work history could be accumulated at any point in your lifetime. So if you graduated high school or college and went straight into the private work sector, and you have worked nonstop until you are ready to retire, the first 10 years of your work history, you accumulated enough work history to be eligible for Part A at no cost. If you worked part-time jobs over the last 20 or 30 years, if over the course of those 20 or 30 years, that part-time work in that private work sector where you have paid taxes through employment have accumulated to 10 years worth of work history, you will be eligible for Part A at no cost. If for some reason you have not had enough work history paid into the tax system, have that 10 years of work history under your belt, you can purchase Medicare Part A when you become eligible at 65, but it is going to be kind of expensive based on how much work history you do actually have in the system. Social Security is who keeps track of that work history. And so if you're not sure, you would contact Social Security directly to find out how much work history you do have in the system or not. But to buy Medicare Part A, if you don't have enough work history, for 2021, that monthly premium is $471 per month. If you have less than 30 quarters or 7.5 years of work history, if you have more than 7.5 years, it's slightly less premium, but still rather expensive. If you are married and you were the stay-at-home parent, and so you don't have a work history, but you've been married to your spouse for 10 years or more, and they were the primary breadwinner of the household, you could potentially be able to acquire Part A at no cost under that person's work history. But again, you would have to be married for 10 years or more in order to qualify for that. Again, it is Social Security that makes those determinations on who is eligible for Medicare based on what scenario. So you would have to contact them directly to determine how you might be eligible for Medicare Part A at no cost or not, or to determine that you have enough work history on your own work record. Any questions about any of that? And again, you can unmute or type your question into the chat box. Okay. So now let's assume you have Part A. What is that going to provide to you? What kind of coverage does that give you? So Medicare Part A, again, is going to be your primary coverage for basically inpatient services. And the most common inpatient service is an inpatient hospitalization. Medicare Part A will cover all costs for any needed inpatient hospital stay after an initial deductible. For 2021, each time you're admitted to a hospital for an inpatient hospitalization stay, Medicare will apply an initial $1,484 deductible and then pay the rest of that stay at 100%. And that covers you up to 60 consecutive days in that hospital. If for some reason you are in the hospital for longer than 60 consecutive days, Medicare will continue to pay the majority of your hospital expenses, but they will start applying a daily coinsurance. So starting at day 61, again consecutively, Medicare would start applying a $371 per day coinsurance, meaning they'll pay everything except for $371 a day. And then if you're really, really unfortunate to still be in the hospital after 90 days, that coinsurance goes up to $742 and you start going into your lifetime reserve days. So for an inpatient hospitalization, Medicare will cover you under a benefit period of a maximum 90 days, consecutive day stay. Hopefully, most of us will not find ourselves in a situation where we're in the hospital for that long. Most hospital stays are a week or less. But whether you're admitted to the hospital for 1 day or for 90 days, Medicare Part A covers the entire cost of that inpatient hospitalization after, again, a $1,484 deductible, which is applied per admission, not per year, but per admission for the first 60 days, and then a coinsurance starting at day 61. Again, that would be a very rare scenario to be in the hospital for that long. And you get an unlimited number of these benefit periods. So if you are admitted to the hospital for some reason in January and you're there for a week, and then in July you have to go back into the hospital for a reason, and you're there for another week or 10 days, each time you're admitted to that hospital, you start a new benefit period and you would be subject to a new deductible. In order to be subject to a new deductible when you're admitted to a hospital, there would have to be at least 60 days in between the time you were last discharged from a hospital to the next time you're admitted to a hospital. 60 days or more would have to elapse before they can apply a new deductible to a hospital stay. If there are less than 60 days between the time you were last discharged from the hospital to the time you're readmitted to a hospital, then potentially you are going to go back in on the same benefit period that you were discharged at. And the daily count will start from where you left off when you were discharged. The same benefit criteria applies if you are admitted to a psychiatric inpatient hospital. However, Medicare does limit the number of days they will pay for inpatient psychiatric hospital care to 190 lifetime. There is no limit to medical hospital coverage, but for psychiatric hospital coverage, it's a 190-day lifetime maximum that they will cover. While you're in the hospital, there are some items that Medicare will not pay for. Personal convenience items such as telephones and TVs are pretty standard these days and are not charged separately when you're in the hospital. They're pretty much provided for your convenience at no extra cost. However, Medicare would not pay for you to be in a private room unless it was deemed medically necessary and ordered by a doctor. Medicare Part A, and actually no part of Medicare, will ever pay for the first 3 pints of blood someone might need. Medicare Part A does not cover private duty nurses or room sitters while you're in the hospital, and it would not cover what's considered self-administered drugs while you're in the hospital. And basically, self-administered drugs would be medications that you were given by the hospital on the day of discharge, most likely. On the day of discharge, you're no longer considered an inpatient. And if it's taking them forever and ever to get you discharged, and it comes time for you to take maintenance medications, and they bring you those medications and they hand you the cup and you take the cup and you swallow those pills, you just self-administered medications when you are no longer inpatient in the hospital, and they could potentially bill you separately for that. Again, not a common occurrence, but is something to be aware of. Another thing to be aware of is that if you go to the hospital, say under an emergency situation, for some reason you had to call the ambulance came and took you to the hospital. If you are at the hospital, and even if they take you upstairs and put you in a room at the hospital, you can no longer assume these days that you are automatically being admitted to the hospital simply because you've been put in a room. What you need to be aware of is that you need to be aware that the hospital is required to tell you within 24 hours whether or not you're being admitted to the hospital as an inpatient or whether or not you're going to be considered under observation while you're in that hospital. Potentially, you could be under observation for several days, but think you've been admitted to the hospital when you haven't. The reason that's important to understand is because it's built under two separate parts of Medicare, A or B. And if you're under observation, that is not considered a Part A benefit, and it is billed differently, and you are charged differently for an observation stay in the hospital. But again, the hospital is required to inform you in writing within 24 hours of whether or not you've been admitted or not and why, so that you are aware of that situation. Any questions about any of that so far? Otherwise, Medicare Part A covers any and all needs or supplies while you're inpatient in the hospital, from the cost of surgeries or procedures to supplies and medications.
The emergency room. Or
We're not muted.
oh,
Roma, this is Rick Kavner. Can I ask you a quick question?
Absolutely.
Hey, in terms of the emergency room, say hypothetically, you're having a kidney stone attack. The pain is unbearable, and so you're going to the emergency room, and they, maybe they give you some morphine or whatever to kill the pain. But you're there, and then you're sitting in the emergency room area. You may be for 3 or 4 hours. Pain's relieved. Maybe they give you a strainer or something to filter your urine or whatnot, but you're not admitted. Medicare doesn't pay anything involved with that kind of a scenario?
No, absolutely they would. But that would be covered under another part of Medicare, Medicare Part B. But
would be Part B.
Absolutely be covered.
Okay.
Yeah, just because it didn't end up necessarily being an emergency does not mean that the fact that you felt it was an emergency at the time and that's what prompted you to go to the emergency room wasn't necessary.
Okay, great. Thank you.
You're welcome. The only thing you'd want to be aware of in that scenario is whether or not you call an ambulance and have the ambulance take you to the hospital or the emergency room.
Yeah.
Ambulance coverage has gotten a little stricter in the last few years, and Medicare pays for ambulance services from home to hospital or what have you. If there was no other way that you could get to that emergency room without risking health or health or self. So
does that even include like calling a cab?
if you call a cab, that's on your dime.
Yeah, okay.
If in that scenario that you described, if you were to call the ambulance and let the ambulance take you to the emergency room because you felt it was that much of an emergency, but you really could have called a cab, be aware that Medicare will not pay for that ambulance.
I gotcha. Okay.
Just FYI, because again, those rules have gotten a little stricter about what Medicare will or will not pay for ambulance service.
Thank you.
Any other questions?
Yeah,
Sure,
I
go
did.
ahead.
I did call Social Security and they said my Medicare is going to cost $148 a month. and I can't-
$148.50. Yeah.
So did I work
That's-
enough? I can't get into my account. So
the $148.50, which we'll talk about next, is for Medicare Part B.
oh, okay. Okay, thank you.
If that's the only amount that they're saying you're going to have to pay, that means you have it. You do have enough work history to have Medicare Part A at no cost.
Okay, thank you.
You're welcome. Any other questions? No? Okay. So again, that's basically Medicare Part A is going to cover inpatient hospitalization. Medicare Part A also covers skilled nursing facility care. Basically, skilled nursing facility care is going to be something that is provided to you after a hospital stay. and actually it's a requirement of coverage for skilled nursing care, is that you have a hospital stay of at least 3 days or longer, which means you have to have been admitted to the hospital for at least 3 days or more, and then be discharged to a skilled facility in order for Medicare to pay for a skilled facility stay. Primarily, a skilled facility stay after hospitalization is going to be used for recovery or rehabilitation. As long as you meet that 3-day inpatient hospital stay criteria before you're discharged into a skilled facility for rehab or recovery, Medicare will pay 100% for the first 20 days of that skilled facility stay for rehab or recovery. Starting at day 21, if you are still in that rehab or that skilled facility for rehab or recovery, Medicare will continue to pay, but they will again start charging a daily coinsurance, meaning they'll pay everything except for, this year it's $185.50 per day, starting at day 21. And Medicare will continue to pay everything except that $185.50 per day up to day 100. Again, these are consecutive day stays. So again, first 20 days, consecutive 20 days in the facility are paid at 100% by Medicare. Day 21 through day 100 are paid by Medicare, everything except for $185.50 per day. That 100 days Medicare pays all or part of is considered a benefit period for skilled facility benefits. And you get an unlimited number of these 100-day benefit periods over the rest of your lifetime. Again, you would have to have at least 60 days from the time you're discharged from a skilled facility to the time that you're readmitted to a skilled facility before you would start a new benefit period of 100 days. If there's less than 60 days from discharge to readmission, you may very well be in the same benefit period, and you would start that day's count where you left off when you were discharged at readmission. If you are still in the skilled facility for any reason, after 100 consecutive days, starting at day 101, Medicare will no longer care why you're in the facility because coverage will stop completely from Medicare. And at that point, you will have to assume all patient costs for your continued care in that facility. Other options for continued care in that facility are basically going to be private pay. You may have long-term care insurance that might help cover some of that cost, or you may qualify for long-term care Medicaid to cover some of that cost or all of that cost. Medicare will pay all or part of up to 100 days at a time for a reason. They limit that to 100 days. They have basically determined that if you have not become well enough to go home, even if it's to go home with continued care at home, if you have not gotten well enough to go home after 100 days, then the likelihood of you becoming well enough to go home becomes pretty slim. And at that point, they consider your continued stay in a skilled facility custodial or not medically necessary. And that's why benefits cut off after day 100. The key to Medicare benefits in general is medical necessity. As long as you have a medical need for any medical service, Medicare should and probably will pay for it. Once medical necessity has been determined to no longer apply, Medicare coverage stops. So if you are in a situation where you've had a hospitalization of 3 days or more, you're discharged to a skilled facility for rehab or recovery. If it's determined after 2 weeks that you have gotten as well as you're going to get, or you've gotten well enough to go home, that's when benefits will stop with Medicare. So whether it's 2 weeks or 100 days, once it's determined that you no longer meet that level of medical need, that's when Medicare benefits stop. If you are ever advised by a provider or a doctor to get a service that you don't feel is necessarily medically necessary, you should always think about questioning that doctor about that necessity to have that service. Because again, Medicare will pay for medically necessary services of any kind, but they will not pay for things deemed unnecessary. And the bottom line is it does become your doctor or your provider's responsibility to tell Medicare whether or not something is necessary. They have to bill it in a way that tells Medicare you needed to have that done. And if they're not going to do that or not willing to do that, that's when you need to second guess whether or not you want to receive that service. The last part of Medicare Part A coverage is home health care benefits and hospice benefits. Home health care benefits do require certification of eligibility by a doctor. Initially, that certification of eligibility has to be done every 60 days to advise Medicare that you still meet the criteria for that home care service. And then after a while, it becomes every 90 days. There used to be a limit to how much home care someone could receive under Medicare A or B. Fortunately, those limits have been removed. And so you are able to receive continued home care indefinitely as long as you still meet the eligibility criteria or the medical need to receive those services. But again, keep in mind that home care benefit is only going to provide medically necessary services in the home, such as wound care or physical therapy or something like that. And once your medical need has improved to the point where you no longer meet that need criteria, that's when that benefit will stop. For home health care, deductibles do not apply. Typically, those services will be covered at 100% by Medicare A or B, with the exception of durable medical equipment. So if a home care provider in that scenario provides you with a wheelchair or a walker, that falls under a durable medical equipment benefit, and you would have to potentially pay part of that cost. And there are some limits that apply to what services or coverage will be provided. But again, medical necessity is the key. So as long as you have a medical need that they can provide for, and that need is something that is allowed to be addressed in a home setting, that benefit will be available to you. For hospice coverage, which is basically end-of-life care, Medicare will pay for any and all needs for someone who was at an end-of-life situation. So they will pay for any service or supply that will make somebody comfortable at an end-of-life scenario. What it will not pay for are services that would potentially be designed to improve someone's health if they are getting benefits under hospice. Again, it's designed to keep you comfortable. It's designed to provide social support. It's designed to provide any supplies or services to keep you in the home if that's where you want to be. Again, those services would be paid at 100% by Medicare in that situation. And there is no limit to how long you can receive those services as long as you continue to meet the criteria to qualify for those benefits. Any questions about any of that? So that's,
I have a question.
sure,
If
go ahead.
you are, if your doctor recommends after surgery that you do go to a nursing facility, but you weren't in the hospital for 3 days, does Medicare cover?
They
Even
will,
if it's necessary?
absolutely. The key to Medicare paying for that skilled rehab stay after a hospitalization is that you are in that hospital for at least 3 inpatient days.
Okay, thank you.
So if a doctor really wants you to go to rehab after a hospitalization, they need to find a reason to keep you there for that 3rd day.
Okay, thank you.
You're welcome. Any other questions? Okay, so that is basically Part A benefits in a nutshell. And again, the rule of thumb is that it's basically going to cover primarily inpatient services. Now we're going to talk about Medicare Part B. Medicare Part B is basically going to cover outpatient services. Things to take into consideration, again, if you're already collecting a Social Security income of any kind for any reason, when you become eligible for Medicare A or B, Social Security will automatically enroll you in Medicare A and B. And that premium will automatically start being deducted from your Social Security income. However, if you're still actively employed or the spouse of someone who is actively employed and covered under employer coverage through that employment, you could potentially delay enrollment into both parts or any part of Medicare in favor of that employer coverage. And when that employment ends, you would be able to enroll in Medicare without penalty or delay. For Medicare Part B, everybody has to pay a premium. So while most of us will have been entitled or earned Medicare Part A at no cost, everybody pays for Medicare Part B. And these days, how much you pay for Part B can be determined based on what kind of income you have. There are some situations where you would want to have or need to have Medicare Part B. So if you want to buy a Medigap or Medicare supplement policy or enroll in a Medicare Advantage plan, you have to be enrolled in both A and B of Medicare. You have to have both parts of Medicare. You can't have just one part or the other to be able to enroll in those other kinds of coverage to go with Medicare. If you are retired military and you use TRICARE for life, or you want to access TRICARE for life because you use TRICARE now, if you want to continue to use TRICARE benefits of any kind when you become eligible for Medicare, TRICARE absolutely requires that you enroll in A and B of Medicare. Even if you are still actively employed with employer coverage, TRICARE still requires that you enroll in Medicare A and B in order to keep TRICARE benefits. If you do not enroll in Medicare A and B when you're accessing TRICARE benefits, you could potentially lose those benefits. I also get a lot of questions from veterans about whether or not they should enroll in Medicare Part B because they have to pay for it. Again, everybody has to pay for Part B. If you access VA benefits or VA services, technically VA services are not considered insurance of any kind anyways. They are considered basically services and not benefits. If all of your care is received through the VA and you're happy with that system and you're happy with how that works for you, that's wonderful. Keep in mind that you're limited to services in the VA system. Whereas if you were to enroll in Medicare A and B, in addition to using the VA system, you would have access to additional community providers for any reason at any time. Medicare benefits are good anywhere in this country for any medically necessary reason at any time whatsoever. You do not have to worry about where you are or where the closest facility is. Medicare will cover any medical need wherever you're at. So there can be big advantages, particularly for people who use the VA system, to have both Medicare A and B and have access to the VA system. But you would want to enroll during that initial enrollment period if you use the VA. Again, VA is not considered insurance coverage of any sort, and delayed enrollment into Medicare Part B would cause you to be penalized if you enroll later after your initial enrollment period. But again, if you are still actively employed or the spouse of someone who is actively employed and covered under that employer group health coverage from that employment, you can delay enrollment into any part of Medicare without penalty. And when that employment ends, you would be able to enroll in Medicare without penalty at any time. So you can, if you're still actively employed with employer health coverage, you can enroll in Medicare A and B at any time while you're employed beyond your initial enrollment period, or you can enroll when that employment ends and that employment coverage ends. And that would be without penalty, and Medicare would be effective at that point whenever you need it to be effective, whenever that employment ends. If you delay enrollment into Medicare because of employment, when you stop working and you are ready to enroll in Medicare, you actually get an extended amount of time to enroll in Medicare. That falls under the special enrollment period. Based on active employment with employer coverage, you actually get an 8-month period from the time that employer coverage ends to enroll in Medicare without penalty. So you get an extended amount of time to enroll in Medicare without worrying about penalties. But again, if you miss that special enrollment period, or you simply did not feel you needed to enroll in Medicare when you first became eligible, the only other time you might be able to enroll in Medicare is during the annual general enrollment period. And this is the enrollment period you would use if you simply did not enroll in Medicare at initial enrollment and you were not actively employed. And that was the reason you didn't enroll at initial enrollment. So this is the enrollment period for people who did not have active employment or enrolled during their initial enrollment period. That enrollment period is January 1st through March 31st each year. If you enroll during that time frame, the coverage would not start until July of that year. So it's a delayed start. And you could potentially be looking at paying a penalty for delayed enrollment and not having a good excuse for that delayed enrollment. So basically, the only good excuse Social Security accepts for not enrolling at Medicare at your initial enrollment eligibility is if you were actively employed with employer group coverage through that active employment. No other excuse will allow you to avoid penalties for late enrollment into Medicare, basically. So unless you're actively enrolled with employer group coverage from that employment, you either need to enroll during your initial enrollment period, or you'll have to wait until the next general enrollment period to enroll and potentially be looking at penalties for enrolling late. So again, as we chatted briefly about the costs, the basic cost of Medicare Part B, again, everybody pays the Part B premium regardless of your situation. The base premium for 2021 is $148.50 per month. That is per month per person. If you're collecting a Social Security income, that premium will automatically be deducted from that monthly income every month automatically. You will have no choice about that. If you're not collecting a Social Security income when you enroll in Medicare and you need to pay that premium, you will either be billed directly by Medicare, or you can arrange to have a monthly premium deducted directly from a bank account through electronic funds transfer, which is a relatively new situation for Social Security to allow for payment of premium. Again, it becomes your responsibility. If you're not collecting a Social Security income when you become eligible for Medicare, it becomes your responsibility to let Social Security know that you want to enroll in Medicare if that's what you want to do. If you're going to delay enrollment into any part of Medicare because you are actively employed, technically you do not need to contact Social Security and let them know that. If you intend to enroll in Medicare Part A while you're actively employed but delay enrollment into Part B, again, you'd want to contact Social Security to do that enrollment for Part A only. But if you're not going to enroll in any part of Medicare because you're still actively employed, you do not have to contact Social Security at all. When your employment ends, you will have to prove that you were actively employed with employer coverage so that they don't penalize you and allow you to enroll at whatever month you decide to stop working. And that's usually done through a simple form that you fill out and your HR department at the employer fills out and sends into Social Security to verify that. If you don't fall under that scenario where you're actively employed, you did not enroll during your initial enrollment period, and you are assessed a late enrollment period for Medicare Part B, that late enrollment penalty is calculated based on years. So basically a full 12-month year would have to elapse before they can start applying a penalty. But that penalty is going to equal 10% for every year you delay. And that 10%, so 10% will accumulate. If you delay enrollment for 3 years, you didn't have active employment as the reason for delay, you could potentially be looking at a 30% penalty. So it'll be 10% times 3 years. 30% penalty will be multiplied by the premium for Medicare Part B the year you enroll. So for example, if you were eligible for Medicare 3 years ago, and you're going to enroll this year, and you're looking at 10% times 3 years, that 30% penalty will be multiplied by $148.50 a month. Whatever that comes out to will be tacked on top of the $148.50 per month forever. So whatever penalty you accumulate, once they determine the amount, it will be tacked on top of the Part B monthly premium forever and ever and ever the rest of your life. Penalties never go away. They're every month and they are forever. The other thing you need to understand about Medicare Part B premiums is that they have now become means tested. What that means is that premiums can be based on actual adjusted gross income. So if you have a higher annual income based on your income tax filing with the IRS, you could potentially pay a higher Part B premium than the $148.50. And we'll talk about that in the next slide. For Part B services, Medicare does apply a deductible under Part B as well. The Part B deductible is applied annually, so it's a one-time-a-year deductible, and this year it's only $203. What that means is when you become enrolled in Medicare, whatever services you have first, Medicare will apply to that $203 deductible, meaning they will not pay the first $203 of any services you need or receive for Part B. Once that deductible has been met, then Medicare Part B pays for Part B covered services at an 80-20 split. But you do have to meet that initial $203 deductible for 2021. That deductible does increase. All costs of Medicare do tend to increase every year. So whether it's the Part A deductible, the Part B deductible, the Part B premium, all of those expenses do go up a little bit every year. So be aware of that and be willing to adjust for that. Again, if you have a higher annual income or adjusted gross income based on income tax filings, you may pay a slightly higher Part B premium. That's called the IRMA, or the income related monthly adjusted amount. Based on, so Social Security is who determines whether or not you're going to pay a higher premium based on your adjusted gross income. They are going to make that determination based on accessing the most current, complete income tax filing that they can access, which means basically that whatever income tax filing that they're accessing is old news. So we're in 2021. Hopefully most of us have gotten our 2020 taxes done, but that may not be the case. It may not be a complete year for 2020. So the most complete income tax filing they may be able to access is for 2019. You may have been making more money in 2019 than you are now if you have become retired. So they could be accessing old information, and that's what they're going to base their decision on, whether or not you would potentially pay a higher Part B premium. On the slide, you see the means tested income ranges for a single person and for a couple who filed jointly. Your income has to be pretty significant for this higher premium to apply. $88,000 is the low end threshold for a single person. $176,000 is the low end for a married couple filing jointly. These are the premiums for, or the income ranges and premiums for 2021. These numbers, again, also increase every year. So as long as your income is below $88,000 a year for a single person, or $176,000 for a married couple filing jointly, you do not have to worry about paying a higher Part B premium. You will pay the base premium of $148.50. If your income in 2019 was at that level or higher, you may be receiving a letter from Social Security that suggests you have to pay a higher Part B premium. But Again, if your income is no longer at that level, at the time you become eligible for Medicare, you receive that letter based on that information from the IRS that's a year and a half or 2 years old. You can appeal that decision and simply tell Social Security that you are no longer at that income level, and they cannot continue to force you to pay a higher Part B premium if you don't still have that higher income. And anytime you get a letter from Social Security that might suggest you have to pay that higher premium, it will always also explain the process for disagreeing with that decision. So after all that, go ahead.
Ask a question. It was clear for Part A that a non-working spouse can delay signing up without any penalty, okay? Is that true for Part B also? Can they delay until the spousal coverage of insurance ends?
Absolutely, it's all the same.
Great,
Medicare
thank you.
and B fall under the same rules, absolutely. Any other questions? Okay. So let's talk about what Medicare Part B covers. Again, Medicare Part B is going to be your outpatient services. So any and all kinds of office visits or doctor's visits, all your X-ray and lab work, MRIs, PET scans, CAT scans, any medical, surgical, or anesthesia services that are considered medically necessary or covered by Part B. Medicare Part B will also pay for medical second opinions. Again, no part of Medicare covers the first 3 pints of blood someone might need, but Part B will start paying for blood at pint number 4. Part B covers those ambulance rides as long as they are considered medically necessary. Part B covers your annual vaccines, such as the flu shot, the pneumonia shot, covers the shingles vaccine. Part B covers all your outpatient physical, occupational, and speech therapies, all your durable medical equipment, such as wheelchairs, walkers, oxygen. And there are some limited coverages for other services, such as podiatry, optometry, and chiropractic, as long as those services are deemed medically necessary. So basically, Medicare Part A covers inpatient services, Part B covers all your outpatient services as long as they are considered medically necessary. Things not covered by Medicare Part B: routine physicals, routine foot care, hearing aids or the fitting of them, routine eye exams or the glasses associated with them, and even in a medically necessary Medicare covered service with an eye provider, if that provider provides a refraction of the eye where they blind you and you can't see for a couple hours, even that would not be covered in a medically necessary setting. Medicare does not cover dental care at this time in any way, shape, or form. That may change in the near future, but as of right now, dental is not a benefit of Medicare. And of course, Medicare would not cover anything that would be considered cosmetic because it would not be considered medically necessary surgeries. Now, having said that, Medicare does pay. They won't cover a routine physical, but what they will pay for is what they call a welcome to Medicare preventive visit. So Medicare has jumped on the preventive service bandwagon. Preventive services became pretty big and much more popular in the last several years. And Medicare has decided that it also will provide preventive coverage because it is more cost effective to prevent medical needs than it is to treat them after the fact. So Medicare will not pay for a routine physical. So if you're used to getting an annual physical where you go in and they put you on the treadmill and they do blood work and all that kind of good stuff, Medicare does not pay for that kind of service. What they will pay for is the Welcome to Medicare preventive visit, which is basically going to be an in-depth discussion with your medical provider about your medical history, your social history, your mental health history. Basically, it's going to be an in-depth discussion to establish a baseline with that Medicare provider. And that provider will potentially recommend or suggest that you go and get some other additional preventive services. That Welcome to Medicare preventive visit is available to people who initially become eligible for Medicare. It's a use it or lose it benefit. So you have 12 months from the time your Medicare goes into effect to take advantage of the Welcome to Medicare preventive visit. Regardless of whether or not you take advantage of that Medicare preventive covered service, every year thereafter, you would still have access to what they call the annual wellness review visit, which again would simply be an in-depth discussion once a year with your doctor about the previous year's medical history, mental health history, social history, so that that doctor could potentially recommend or suggest future preventive services. Medicare covers a lot of preventive services, and any service that they categorize or classify as a preventive service, they pay at 100%. So there are a lot of services covered. I've listed 3 of them out of probably 60 or 70 that I can think of off the top of my head. If preventive services are something that you are interested in learning more about, the best way to find that information would be through the Medicare and You Handbook. You can access the Medicare and You Handbook one of 2 ways if you're just becoming eligible for Medicare. You can either call 1-800-Medicare and request that they mail you a Medicare and You Handbook, specific for Colorado preferably, or you can go to the Medicare.gov website and download the handbook as a PDF. In that handbook, there's about a 20-page section that details all the preventive services Medicare pays for, what's specifically covered under that service, what the eligibility criteria is to be able to get that service, and how often that service can be taken advantage of. And the best way to determine which service being described as preventive or not is that it will have a little blue apple symbol next to it. Little blue apple means preventive. But again, the best way to get a full description of preventive services through Medicare would be the Medicare and You Handbook. Again, you can get that by calling 1-800-Medicare and asking that they mail a hard copy to you, or simply go to the Medicare.gov website and view it as a PDF.
Is that the book they call the Blue Book?
The Blue Book,
Yeah,
probably not.
okay.
The only Blue Book reference I know of locally is a resource directory, which is kind of in competition with another directory called the Yellow Book. And that's usually local community resources.
Yes, that's what I was thinking. Thanks.
Now, everything that's going to be associated with Medicare, especially the Medicare and You Handbook, is typically going to be in a red, white, and blue theme. Now, again, if you're just becoming eligible for Medicare this year, you will have to call and request a Medicare and You Handbook if you want one mailed to you. Once you've been enrolled in Medicare for a year, you should automatically get a Medicare and You Handbook mailed to you by Medicare every year. And usually it will come sometime in September before open enrollment starts for Part D and for Advantage plans during the fall. So the first year you usually have to call and request one, but every year thereafter, once you're enrolled in Medicare, you'll automatically get one in the mail.
So is that how you would shop for a doctor?
For a Medicare doctor, no. Actually, you can go to their website, medicare.gov, and they do have a search engine on that website that helps you find providers locally that accept Medicare. How often it's updated, I cannot say, because that has always been a huge question in this community, especially. Our office does typically provide a list of Medicare providers who are accepting new patients in the Colorado Springs and outlying areas. However, because of COVID, we have not been able to update that list in some time. But again, the Medicare.gov website does have a provider search, and hopefully we'll be able to update our providers listing sometime this summer and be able to provide that to people in the fall. Any other questions about Part B? So just as a side note, I can suggest to you that Medicare Part A and Part B by themselves are actually not bad coverage. For both benefits at $148.50 a month with, less than $1,500 hospital deductible and a less than, just over $200 outpatient deductible. It's really not bad benefits by itself. However, next week we'll talk about insurance options to go with Medicare A and B, such as supplements or advantage plans. But A and B by themselves, not bad coverage compared to some of the benefits available these days. However, there is financial assistance available to help cover some of those costs for Medicare A and B if you have limited or low income. Medicare savings programs are financial assistance programs specifically to help cover the costs of Medicare A and B. So they can help pay the Part B premium. They can help with the Part A and Part B deductible and the Part B coinsurance amounts, because again, Part B pays at an 80-20. So Medicare saving could potentially help cover the other 20%. It is something that you do have to apply for unless you are on SSI through Social Security, Supplemental Security Income, or are on another type of Medicaid program. If you qualify for Medicare Savings Assistance, it does automatically also qualify you for financial assistance with drug coverage through Medicare, Medicare Part D. To apply for Medicare Savings programs, you do have to apply through the local Department of Human Services. We do help with those applications through our office. So we can help people understand the eligibility criteria. We can help you complete and submit an application for that program and explain what that program, what program you might be eligible for. Because it's financial assistance, you do have to meet income and asset limits or guidelines. For 2020, and I apologize, this hasn't been updated. For 2021, actually the slides are updated, but the year isn't. So for 2021, what they look at is gross monthly income, meaning pre-deduction income. So if your income falls at or within these limits for a single person or a couple, and your assets, meaning cash assets, checking, savings, investments or IRAs or 401ks, property that you own but don't live on. Those are the kind of assets they're going to look at. They do not take into consideration the home that you live in or the land it sits on, your personal possessions, or your primary vehicle. They look at any other liquidatable asset. If your assets fall within the limits at the bottom there, you very well may be eligible for that financial assistance. At the highest income limit, you qualify at the very least to have the state pay your Part B premium so that it's not deducted from your monthly income. At the lowest income limit, you may qualify for not only the state to pay your Part B premium, but to also pick up the Medicare A and B deductibles and coinsurances. Again, we do help with these applications, and we're happy to talk to anybody who is interested in getting more information about these programs. And I guess that's pretty much all I have for tonight. Again, I am with the SHIP office, the State Health Insurance Office. We do not sell any insurance products. We do not endorse any insurance products or companies. We are true consumer advocates that are here specifically to help educate and assist people with all things Medicare. So we have no financial skin in the game. We're here to be true consumer advocates for you. And we are happy to talk to you about any and all Medicare or Medicare related topics that might apply to you. Again, you can call us at our local number, or if you call the toll-free statewide number, it will route you to the SHIP office closest to where you're calling from. If you want more general information about the SHIP program across the country, you can go to the shiptacenter.org website. It has some wonderful information. Our office also provides the SMP program, which is another Medicare program that specifically educates and assists people regarding Medicare fraud and abuse. And we are happy to provide any information or assistance if you think that there are situations that may not be above board, such as getting bills for things or services that you did not ask for or receive. If you are getting phone calls that you're not sure are legitimate, any type of suspicious activity, we are happy to help educate or assist you with. And certainly we can help you pursue any actual fraud or abuse that might be occurring through the proper channels. We are always, because we are a grant-funded program and we do not charge for our services, we are always looking for volunteers. Doing this kind of work and helping people and educating them on anything related to Medicare can be a very challenging thing to do, but it's also very rewarding to be able to help people understand something so complex and so important. Is a very rewarding thing to do. So if anybody's interested in any volunteer opportunities, we are more than happy to talk to you. We have several different kinds of volunteer opportunities for people, and we're always happy to talk to people who might be interested in helping in any way they can. And the last comment I'm going to make is, again, please be aware that you will receive an email probably tomorrow that includes a survey. The survey is being put on by the Administration for Community Living and the Office of Budget and Budget and Management, so both federal offices. Those are the offices that basically determine whether or not we will be funded from year to year, so that we can provide this service at no cost. So these surveys can be very important in relationship to our ability to continue to provide these services and our ability to remain funded to provide these services at no cost. So we do greatly appreciate if you will take that survey, take a few minutes to complete that survey, and it will help support this program in the future. Other than that, I think that's all I have for you tonight. I appreciate your attendance and your attention. And if you have any other questions, I'm happy to answer them now. You're very welcome. Again, you can unmute or type into the chat box.
Yes, thank you. This was very, very informative. Appreciate it.
You're very welcome. Hopefully I will see you all next week for the next part of this series.